Hello and welcome to Encouragement on Fire. Today I have with me a wonderful person in our community. Her name is Dr. Fhteachia Andrews. Welcome. You know, I have been talking about you on the podcast, and now they have a face with the name. And we have a lot of different questions in our community that people are really interested in. And I thought that you would be the perfect person that could really give some good content, some good insight, moving forward. So the first thing I want you to tell our listeners as well as our viewers, tell us who you are in the community.
My name's Patricia Andrews. Actually, I am a nurse practitioner. I am dual certified as a family nurse practitioner and also a psychiatric mental health nurse practitioner. I do have my doctorates in nursing practice, and I have been able to have the opportunity and privilege of treating a lot of different populations. So I've had cardiology, patients, endocrinology patients where I treated diabetes, thyroid, people that's dealing with like PCOS, which is ovarian syndrome. And also now I am primarily in the psychiatric mental health field at this moment. So I help a lot of people with their mental health.
Wow, that's a lot. That's a lot. I thought you were gonna say like da 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 da. And no, you're like, you ran it down the line. And I'm like, and I'm certain that's not all that you do.
No.
And yeah, hopefully we're gonna get an opportunity to really talk about it, perhaps today, perhaps in the days to come. So you're definitely qualified to talk about this topic as well as a lot of topics that we're gonna discuss. Um, one of the questions that we want to really, get right to, we have a lot of listeners and they're going through cancer, they're going through different types of sickness. And many times people complain about their doctors. I know you've heard it, like they come to you and they complain about other doctors. And, we try not to take sides because there's always some circumstances that we don't quite understand of why. But what is a good way for anyone who's listening for them to perhaps, find a good quality doctor? How would they go about doing that?
Well, if we're talking about just finding a quality doctor, there's a couple different ways probably. One is always word of mouth, first of all. Sometimes just who your family and your friends know, who basically they know that that provider is a wonderful doctor. That is someone that they feel comfortable with and they trust. And a lot of times they'll say, Dr. So-and-so, I really love him or her, and you may too, and it may not be the right doctor, but at least, sometimes word of mouth referral wise. And then there's other times where you can go online and, research someone that's in your area who basically has good reviews, someone that people say that they listen and kind of, to what the people are saying. But in reference to, online searching, that could be another way. But at the same time, when we are looking for like the right doctor, there's different ways of preparing. So if you ever want me to share with you how to prepare for those doctors, then I can go into that.
Please do. Please tell our listeners, how do you prepare for the next doctor or the doctor for you?
Okay, so in reference to you kind of preparing, when you're going to a doctor, most of the times you're going because you're feeling a certain way, right?
True.
Some people do their annual physicals, things that they need to do, and sometimes people don't. But sometimes the first time they go to someone is because something is going on, okay? Or they're doing a follow-up because something is going on. So what I would suggest as a person to do is when they're bringing in, something that they're actually writing down, how you feel, what is good, what is not good, if it's something that's been going on with you, You write down every single thing, every symptom, anything that's different with you. For instance, like when I send my husband to a doctor's on his own, because I may not be able to go, I am writing every single thing. He's feeling fatigued. He's not feeling, he's laying in a bed. He's, maybe we were vomiting, maybe we had nausea. Whatever it is, you want to write down every single symptom that you had, because you may not remember it all when you get there. It's just our human nature, our brain. So, the best thing is to write it all down so that when it's time and you're sitting there in front of the doctor, you can say, okay, this is what, because they'll interject and, ask you questions, and then they may move on to another. Say, oh, no, I have more, this is what's going on. This is what's going on. That's going on. And so therefore you kind of know, that you're getting everything across, because one little thing that you can say that you might have forgot, or you said at the very end, and you're like, aha, I need to go check this, or aha, this is going to lead them to check another type of testing that's going to lead them to know, what it is that you have for them. But when you're making it, you put all your concerns down and you prioritize everything, because there's some that's more important than the others for you. You just don't leave anything out, but just know that you want to get it all in there. But when you're actually going to prepare for whether it's a new doctor, whether it's your same doctor, have all your prior tests. You might have gotten mammograms, colonoscopies done, vaccinations, blood tests. Anything that you can bring with you, bring it, because they need to know what's already been done. So one, they don't kind of repeat stuff, causing more things to be, costs of it, costly insurance, but also just so they know that, okay, this has already been done. And then let your provider know about, things that within your medical history. For instance, write down your family history, ask mama, daddy, auntie, uncles, whatever it is that's going on in your family. Ask them what is going on with them, and so that you have a clear picture of what could possibly, doesn't mean it's going to happen to you, but some things are genetic, right? And when they're genetic, and if you feel in a certain way, they don't know the test for this. Like, for instance, if you have somebody that's in your family with diabetes and they may be close to you, they don't know that this is a person who has diabetes that's in your family. They may need to check you out for that. Or it may be a cancer of some sort that they went through, and they may need to check you for that. So some things are familial.
You are, like they always say, you speaking to the choir. I remember years ago, when you were, years ago, when you were becoming a doctor, and you mentioned always write down any symptoms that you're having, and don't wait until the last minute. So if you start feeling some kind of way, I remember you saying, just jot it down on a piece of paper and put the date.
Yes.
So you always have a record, because if you're still having the symptoms months later,
yes,
then that's a record you can take to the doctor and say, this has been going on for 6 months.
yes.
This is something that, I've been feeling. And that's what happened to me when I went to the doctor and I demanded to see a specialist. I had seen the doctor 4 times, and I kept telling him, I'm still feeling this pain. It's happening to me every morning, afternoon. And I kept telling him, and he kept saying to me, it's arthritis. The problem, I think, with all of that is he knew that, I don't think we had arthritis in our family, but he also didn't know that I had a father that had prostate cancer, and I had a brother that had another form of cancer. Do you see what I mean?
Yes.
And perhaps if I had known at the time, because I didn't,
yes,
if I had mentioned that to him, he could have said, we're going to get you tested for these things, or we're going to get you blood work just to see.
Yes.
I don't know. And all of those things come together. That's why from this point moving on, I tend to stick with one hospital.
Okay.
Because if I stick with a specific hospital, they have all of my records
absolutely
in the system. So if I show up, or if God forbid, ever have to go to the hospital emergency and they ask me, I say, all my records are at such and such hospital. All of my records are here. Do you see what I mean? I know now, like you said, they can pull from everything. And and then they can surmise based on good information how to move forward. But if they don't have some information on me, it's kind of difficult for them to do that. And see, that right there is, that's enlightenment, that's empowering, just to know doctors need all of the information.
Whole picture.
Leave things out.
They
can only go by what you're giving them.
That's right. That's right. And a lot of times we get upset with them if they don't do the right test or do the the diagnosis stuff that they need to, whatever, but they don't know if we don't share it. And I have people when they come to me at times and I'm asking their first appointment is called their initial appointment. And I'm asking, like, for in my field where I work at now, I'm asking what psychiatric illnesses does your family deal with? And I'm saying everything down from the depression, bipolar, everything, suicidal, alcoholism, everything. And then I'll get some people from our communities and like, I don't know, because we're so tight, so close, tight-lipped and closed that we don't share. But I do compel us all to know what we have in our families so that we can give it to our doctors when it's necessary. Because like you said, if they had known, maybe he would have done something a little bit different earlier. But at the same time, if you didn't know, it's not your fault. But if we talk about it and have conversations with our family, it's a good thing. And
you said one important thing, our communities. Yes. And I know why you said that. So I want to share that with our community and our listeners. When we say our communities, both of us are from a minority community. So, African American, you have Latino, like there's different minority groups. And many times we don't always go to the doctor.
That's right.
And then if we go even further than that, statistically, we know that sometimes our men go less than our women go to the doctor. So that is what we're talking about when we say that our community right now. We are encouraging people to go for your annual physicals, because then the doctor at least can diagnose quicker than for it to get, like many people that I've interviewed over the time, they got to stage 4. And if they had information or they went to the doctor earlier in their treatment for cancer, they may be here.
Yes.
But it's unfortunate in our communities, we wait too long. So I'm glad that you, as a doctor yourself, saying that we need to do this more and encourage each other. I told you at the church, those women were on me. Gotta go, you gotta go. And I'm so glad I did. Even recently, I received for both. Now listen to this, I have to go because I have dense breast tissue. So I had to go for the regular one and then the ultrasound one. And both of them came back clear. And I was like, yes, yay. And that's what you want to hear. And if you don't hear that, you at least want to hear, last year it was clear, this year we need to get on it.
Early detection.
So that's wonderful. Thank you for saying that, because so many of our community members, we need to talk about that.
Yes.
So also I wanted to ask you, have you had anyone very close in your family knit that was diagnosed with cancer? If you're willing to talk about that and share anything, the pros, the cons, what could be done or what should have been done, maybe, that, because knowledge is power.
I'm glad you actually allowed me to share it all. So my grandmother was diagnosed with was a small cell lung cancer, and it's one of the more aggressive types of cancers. And so basically, for her, to be honest, it could have been prevented. And I'm gonna tell you why. Some cancers cannot be prevented, and but this one, because she smoked, She did smoke for 50 years. And the main thing is, what I can remember when my grandmother went to the doctors in the beginning, she was like, yeah, I smoked for 20 years. And we're like, you did not. You smoked for 50 years. Just be honest. So basically, everybody be honest on how long you've been doing something. But we giggled with her every time because it was like, all right, she already got cancer, but she's just, she's over here playing with us, but it's fine. So, and I'm so sorry, I can't remember the stage that we were in, but my grandma was 77 years old, okay? And she had comorbidities, which meant that she already had diabetes, and also she was on dialysis, and she was doing peritoneal dialysis at home. So, and they were living with me. Her and my grandpa were living with me at the time. And so at that moment when we found out, I think she must have went to get like an x-ray of her chest for some reason. And incidentally, they found a spot. And then with that, that's when we came across, okay, yes, she had a bronchoscopy, which they went down her, her throat, her lungs, and took a sample.
Yes.
And biopsy it, do the pathology report, and found that it was the cancer. And so at that time, I'm like, I'm in school at that time to become a nurse practitioner. So I'm in my, like, it was January when she was diagnosed. So I'm in like the beginning parts of it. And I'm like, okay, she wanted to make her own decisions, which is fine because we need to do that. They need to be empowered. But it was just something in my spirit. It was like, you want the chemo? And she was like, I want everything that's going to kind of, make me be here longer. I just want to be here. And I'm like, okay. I call her my mom. Okay, my mom. But then I'm being honest with you, in the back of my mind, I'm saying, you're older and you have diabetes and you have a dialysis going on, kidney failure. I'm not sure. That's just the other part of me, because I kind of know, as even I wasn't NP then, but I was a nurse, and I'm taking care of people in the nursing home down the street, from where I lived at, in the rehabilitation center, and I see what can happen. And so for many people, early detection is wonderful. There are a lot of different chemotherapies that are out there that helps everybody just become healed, set free, and being able to be here for years and years and years. Okay, so, and there's different ones that are more aggressive and things that are not as aggressive. But what happened with her was that she had the chemotherapy, some treatments, and I can tell you this, I saw the decline in her from the second month on. And January is when she had her first treatment, and September we were burying her. And I, as a nurse at that time, because I'm almost finished with my NP program, and I said, what could I have done differently? Could I have said, maybe we shouldn't have that? Maybe we can just, be here a little bit longer if we did, because chemo on some of the different bodies with different elements is a lot on them. And for many others, it's not. Okay, and it helps them to get through. But for her, I'm not sure if that was the best. But because of autonomy, which means, independence, she needed to be able to make her own decisions. I just helped her along that process. So I was blessed enough to be able to sit through her chemotherapy process while she was getting her chemotherapy. I was able to sit there. I was able to go to her doctor visits. I had to, at some point, be able to do her dialysis at night because she was a little too frail to do it. And then her mind started to go down some. And so she went through like a dementia type of thing. So it just wore on her. And so I particularly can't tell whether it just aggressively, the cancer itself just kind of just took over. Was it the chemo too much for her body? But at the same time, she was able to be here with us, and I loved on her, and I was able to tell her that I love her. I was able to care for her, and at the same time, it's all good because. And then right after, I said, what should I have done differently? A couple years later, I'm asking, what should I have done differently, if anything? I was thinking the other day, could I have done? And you know what? I could not have done anything differently other than, maybe stopped her in the beginning years from smoking. But, we make our decisions. But I'm happy that I was able to go through that process, and they were not by themselves.
I'm so glad that you were able to be there for her. And we all question. Listen, I just recently this year went into remission, and I'm questioning my process and saying, what could I have done differently? Should I have done this? Should I have taken the chemo? Should I have waited? I think we all go through that process. Some things we know won't do that again. This is what it is. But I'm thankful, like you, going through the process with her, you were able to keep her here a little longer. Perhaps you won't know.
Yes.
But like you said, chemo affects people differently. I've seen people, I've been interviewing people, the chemo, some people, they're not as affected. Then there's some commonality,
Mhm.
the breakouts. There's so all these different things that we all have gone through. And I can relate, and I remember your grandmom. So I love her too. I love her. And I remember, what from what you're saying about the body, I can't imagine being older
Mhm.
in going through the chemo that I'm pretty sure she and I both shared some similarity.
Yes.
And then she also on top of that had the other diabetes and different things.
Mm.
I can't even imagine that because I went through from April through November with chemo, and to the point where I was almost in a wheelchair.
Wow.
So, you know, I can't imagine that. I'm just being honest with you, the process that she must have gone through and trying to overcome all of that. So, I wouldn't even say, well, should I have done? No, you did the best you could in
Thank
that
you.
particular situation. As we continue to grow in life, we are more knowledgeable about how to move forward, but everyone is affected differently.
Absolutely.
And you don't know. You just don't know,
Just don't.
But I appreciate you sharing that.
Oh,
I think in the time we've known each other, I don't think you've shared that detail with me. I was not aware of that. Yeah, we're going to talk about that a little more in private too,
yeah.
going forward, because I'm pretty sure there's some things you can share outside of the listeners that we can kind of talk about. I'm very sorry that you lost your grandma, because she was a sweetie, just a
Yeah.
sweetie. I remember just such a sweetie,
Yeah, she was
and do
something.
anything for anybody. And
Yes,
I
she
didn't
was.
know she smoked for 50 years.
Yes, she
I
did.
knew she smoked a little, but I didn't know
No,
she
she
smoked
was
for 50
50,
years.
50 years.
50
But
years. But
she,
see, look at that.
yes,
I never smoked a day in my life and still got cancer.
yes.
So everyone's body is totally different. You know
Hmm.
what I mean? Like she could
Absolutely.
have gone the rest of her life and never gotten cancer.
She could have.
There was a possibility if there was some
Possibility.
other changes she might have made, maybe food or something, and
That's
still
right.
smoke. Enjoy her smoke. I'm just being
And
honest.
and I'm sure there was some foods we could
You
have
know,
changed.
yeah. So in life, you can't say this is exactly why this happened.
Yes.
No, no, I don't think it's not that cut and dry. It's like the history you were talking about earlier. Well, we look at all of these things, but it doesn't mean this is the final outcome. There could be
Absolutely.
some underlining things we don't know about, hereditary, all these other things. So yeah, thank you for sharing that.
Oh, you're so welcome. My pleasure.
Um, and what could you say to individuals moving forward? What advice as a doctor, what could you tell them in their process, whether they are a caregiver to someone else, or they're going through their process themselves, or maybe they even came out like myself, and what to do moving forward.
Mhm. You know what? I want to talk to the caregivers that are out there. And the reason being is because I've been a caregiver for a while. I've cared for my husband when he's not able to, and then he picks up, and then he goes, and then I care again when I need to. I've caregived for my grandmother, like we just talked about,
Yeah.
and I caregive along with others with my grandfather who has Alzheimer's disease.
Mm.
And I know you have wonderful caregivers for you. And I do want to say to the caregivers is that one, the people who you are giving care to, they absolutely need you. You are crucial to them. You provide a life source to them as far as like making sure that they're eating and that the spirits. I just want to go up to like they're taking the medications and what, but their spirits are uplifted because they have you in their life, okay? Because they may, get a little depressed, or sad, or anxious, worried. They may feel a little uncertain about what's going on in their lives, and because they have you that's there. But I also want to say to you is that it could be a lot on you too, okay? Because you as a caregiver need time for you to care for yourself, all right? Because you also can be affected, by their mood as well. If you see them sad, that can make you a little sad. You see them worried, that can make you a little anxious as well. And you may not always take care of yourself the right way because you're caring for them. So my number one thing is that you're there for them, but also make sure you take care of yourself in the process, because not only do they need you for them, but they need you for you, and you need you for you. Okay. So make sure that you're eating and you're resting, you're getting your sleep, and you're also exercising whenever you can exercise, and you're keeping your mood together, and you're talking to someone if you need to talk to someone. And that's basically who I wanted to talk to today.
Oh, that is wonderful. I tell you, this is everything you said was wonderful. There's a lot of good content here. And I think that people are going to go away with being, I would say smarter, but I know all of our listeners are intelligent, but they're just going to go forward and have some new information that can really help them. And I'd like to say you are looking great.
Oh, thank you.
You are looking fabulous, girl, fabulous. And I want you to tell people, what you have been doing, because I know you've been doing something, because now, you always look good, but in the past year, you look even better. I'm just being honest with you. So can you tell us, what have you been doing?
Yes, I definitely can. And thank you so much.
I'm speaking the truth.
So,
I just want to tell you,
Yeah. I actually, over the past, as I was sharing with you as a caregiver, okay, we started caregiving for a while, I have not been taking care of myself. All right. So, and I've been in school for all these years. So, when you're in school and you doing online stuff, you're studying, you're online doing classes, and so you're eating, okay, and you're eating and you're not exercising, and then the weight is pounding on. Okay.
Yes, I do know about that.
Yes. And
Yes, I
so
do.
what I decided back in January is that enough is enough, and I need to take care of me. Okay. So I needed to make sure that I became healthier. So now what I am is I took me first, and in the midst of everything, I'm also a certified health coach. And so I am helping me right now to lose some weight. Okay. I needed to get down to my healthy weight. I'm not there yet, but I can tell you since January, I've lost 28.6 pounds. And so I'm very happy.
Wonderful.
I still have some more to go, but also, I guess turning 50, some things happen, like hormones that occur. And so I started not sleeping as well, so, but now that I've lost some weight and I'm eating healthier, I am sleeping a lot better. I don't particularly wake up like I did unless I'm going to the ladies' room, because we're a little older at times.
Yes, I do know about that.
But it's not like staying up like how I was, or having a hard time falling asleep. And then now I'm able to, because I lost some weight, I'm able to get up and be motivated to exercise. I don't get a chance to exercise Monday through Thursday because I have the 10-hour work shifts, but I make sure I do it on Friday, Saturday, and Sundays now. And I had to start out with I don't know if any of you know, and I asked you all to find him. His name is Paul Eugene. He's on YouTube. He is excellent. I started out with the seniors. All right, don't laugh at me. I started with.
I'm not laughing at you. Thinking
So
of
I was like,
someone who's in PT right now, and I'm not really exercising, but I'm doing that.
And so I was like, I could barely make it like 15, 20 minutes. I'm like huffing and puffing. But now at least in my 30 minutes, and I'm doing the faster stuff, a little bit here or there. But I like to dance still. That's what I like to do. So in all, I just started to eat better, lose some weight. I'm now, instead of on 2 blood pressure medicines, I'm down to 1 blood pressure medicine.
Wonderful.
I'm praying that I can get off of the other one as well, but taking it slow.
Right. That's fabulous.
Thank you.
And that's part of the process that we've been talking about on this podcast. To our faith-based listeners, because we have people who are faith-based and who are not. But to our faith-based listeners, we're always talking about faith without works,
Yes.
right?
That's right.
And so we can pray, we can have faith and do all that, laying on of hands, but nobody wants to do the work.
Oh, oh,
And I do believe when somebody lays hands on you, you are delivered.
absolutely.
But now you got to actually work at being delivered, you know? So now you have to eat better, you have to exercise, you have to do those type of things for your body, not somebody else's. And so that's what you're talking about right now.
Yes.
You
Yes.
decided to do the work. You're going to start out slow. You're going to work your way up. And look at that.
Yes.
Your deliverance literally is happening by one, medications taken off, one by one. So you're doing it. You know, you're walking in the realm of healing. I'm healed. And now the manifestation is just happening. So I think that's fabulous. It's just fabulous. Oh my goodness. Let me know when you're total medication free. And I'm walking with you by faith, you know.
Right. Awesome. Right. And then on top of that, it's my goal to help other people, you know, do the same. There's like so many people who just they don't know what to do. They don't know how to do it. And I just want to be their guide, you know, just helping them. So I've been helping a few people here or there. And I'm like really like happy because some people are seeing some, you know, some good things happening to them. So, you know, it's just really educating people about what we can do. We don't have to stay in the same boat that we're in. We can always, you know, like you said, faith without works is dead. So put the work into action. But sometimes we don't know what to do and how to do it. So we just need, you know, help with someone.
And so if anyone is interested in the path that you're going through, can they contact you somehow to be able to do that? Or is it better for them to contact the program that you went through? How does that work?
They can contact me.
Okay.
Yeah, so I guess what I probably would say is that if you're on Facebook, you can look me up, Patricia Andrews.
Okay, so I'm gonna, in the scroll at the bottom, I'm gonna put your information for them to actually look you up on Facebook. Do you have an email or anything like that?
I have
an
email I'll provide to you too. Email
okay, all right. And if you say it, I can scroll it right underneath. So
it could be Andrews FM, the number 3 at yahoo.com. So that's wonderful. Andrews, F as in Frank, M as in Mary, 3, the number 3 at yahoo.com.
Wonderful. So we'll get them that information as soon as possible. Like I said, this content has been wonderful that you have provided to our listeners. And I know I'm going to get a lot of feedback. They're going to be like, okay, how do I contact her again? Even though I put it on there. And that's okay, because that's what I would have done. I'm going to need to get her information. And those individuals that can't see you, see, I can see you. They're going to be listening. But I'm telling you, she looking fabulous here. So, and I seen the before and after. So I'm like, I had to ask,
she knows really
what are you doing? You know, so that's wonderful. And, you know, once I get stronger, because there's another program that I heard about as well as yours. Okay. And as I get stronger, I'm in PT building my core right now. So once I get there, then my doctor said I can do the next step. You know, we got to do this process in steps. Don't try to skip over steps. If your core is not in good condition, you know, you really can't do exercise as well. You're defeating the purpose. You're kind of hurting yourself. At least that's what they told me. And they said, sure, you got to do that. So, and I've noticed in my exercises, you know, exercising the core, these little tiny exercises that you think, oh, this is nothing.
It's working.
The next day you are hurting. Yeah. And I'm like, oh, why am I hurting? My husband said, it's because you're exercising your core.
That's right. That's right.
And oh my goodness, do you know, in a short period of time, I noticed an improvement in my walking.
Oh, really? That's wonderful.
Oh my, I'm telling you. And my doctor had to give me a handicap, you know, what is it called?
The placard or the?
Yeah, the handicap placard for my car. And at first I wasn't going to take it, but I said, you know, I need it. I can't, you know, I need to be able to get into a place quicker than than I was doing. And, you know, while I'm in my process of my physical therapy, my chiropractor, doing the things the doctor's telling me to do, my exercises. And now I'm starting, like, I mean, I'm not quite there yet, but I noticed it. I
Good.
noticed the difference. And I was like, I'm going to keep working at this.
That's
Because
the most
one day my goal, like you said, your goal, my goal is I'm going to be walking the way I was walking before.
yeah.
You know, look, I'm not even talking about running at this point. I will be walking the way I was walking before. And I hope that you will join me too. I know you are out of state. But even if you join me in your state and you do a video of you walking, we're going to be walking at the end of the year. I'm probably going to walk for the Cancer Society, but I'm also going to be walking for under the meeting house, but for house breach restoration with the symbol behind us, Conqueror. And we have many people in the community that said they would join me. Every year we're going to walk and we're going to raise money. We're going to contribute to places like the Cancer Society and other organizations, but we're also going to be donating to individuals in the community that are in need.
Oh, that's good.
Because a lot of times people think, oh, well, you know, they have this and no. Sometimes people have to choose. Are they going to pay their medical bill or are they going to eat?
I know.
You know, and unfortunately, sometimes they have to choose, you know, the medicine. And then the other days, well, I gotta eat. So how do you decide between the two? You know, so we're gonna be there to help them on various items. So, you know, if you can during that time, if you're in town, if you're in the States, we will welcome you. We'll have a t-shirt for you. You can walk with us. But if not, you know, just send me a little video. I'll put you in the clip somewhere on the other videos that Tisha was walking, Dr. Tisha was walking with us. You know, yeah, because this is important, you know, helping other people. Like you said, you went into this because I needed to help somebody. You know, and there are far few people out there who will sacrifice for others.
That's right.
And that's what you're doing every single day. So is there any last things you would like to tell our community members?
No, there are some worksheets that I will see if I can have you all provide to you to help you in preparation. There's a lot of things I didn't kind of go over for preparation for your appointment. And it just may help to kind of hone in some things for you so that you won't forget stuff and that when you get there to your appointment. But these are things that you can find on the National Institute of Health website, but we'll see if we can actually have links on here for you to be able to get to.
Oh, that's fabulous.
Thank you all for letting me share with you today. I've had a great time. Thank you.
Well, thank you so much, Dr. Fhteachia Andrews. You have been, this interview has been wonderful. I just want you to know that. I know you're thinking, I do this every day. This is regular information. This information was valuable, okay, to all of our listeners. And we hope to have you back again, because I know they're going to ask me questions. And I'm like, I don't know. I have to ask the doctor. Okay. So we'll have you back again when they start putting in the comments that we want to know about this. We want to know about that. And then perhaps you'll be able to share experience as well as knowledge to our listeners. Okay.
Absolutely. Thank you.
All right. Well, thank you again for joining us. This has been Encouragement on Fire with Dr. Fhteachia Andrews, and we will talk to you soon. Have a good day.